wanted to jump on here and just share my story about post-COVID and what I've gone through. After I had COVID, I had severe neurological issues occur to my body, and I went weak in my arms, legs, hands, feet, and then I went into temporary paralysis where my arms or legs just would stop working altogether. And I was terrified. I had no idea what was going on. I was in the hospital. Doctors were trying to figure it out. They were running tests of every sort, and they couldn't figure it out. So they just started kind of pumping me full of steroids when I was in the hospital. And it kind of started to settle down my symptoms. But then when I was discharged, I went home for the next 6 months. I had paralysis come and go. I had severe weakness in my arms and legs. Then it just started to affect my heart. It started to affect my ability to breathe. And it was terrifying. I thought, all right, this is how I'm going to die. I don't know what's happening. Doctors can't figure it out. So I finally found a really good neurologist in the St. Pete, Florida area. And he said, you know what, let's conduct a couple of tests to see what's going on. So first he did a physical exam, and he noticed that my reflexes in my knees were completely absent. I had no reflex. It was just completely absent. So then he's like, all right, we're going to order some blood testing, and we're going to order something called a nerve biopsy. And we're going to see, he started to predict something, but he wouldn't tell me what it was. So those tests came back, and the nerve biopsy, which what they do with that, by the way, is they take a small portion of your muscle tissue, they send it off, and they analyze it for cell damage. So they did that, and they said, you have cell damage, and you have a disorder called Guillain-Barré syndrome. Now, Guillain-Barré syndrome is an autoimmune disorder that actually is where your immune system starts to attack your nerve cells. And it's because your immune system is so overwhelmed with whichever virus is in your body that it does not know what to and what not to attack. So it starts to just attacking everything. This is very common in respiratory infections and in food poisoning. And obviously, since COVID-19 is a respiratory infection, we're seeing a lot more cases of Guillain-Barré occur post-COVID. And a lot of people are out there that are not aware of what they have, or they have not been diagnosed properly because it is a rare disorder. But we're seeing it more now after COVID, so it's not really rare at this point. So I wanted to jump on here and share this with you, because the first thing you need to do, guys, is you need to see a neurologist if you're having any of these side effects. Don't pass it off, because I went 6 months misdiagnosed, and there are treatment options out there. If you get them quick enough, you can reverse the damage, or at least put a stop on the damage that is occurring, and it can reverse some of that, potential harm to the body. So let me go over a couple of different things on how you can get diagnosed with Guillain-Barré. Like I said, first thing they're going to look for is a physical exam. Your doctor's going to look for, absence in reflexes. They're going to be looking for weakness in your arms or legs. They're going to look for a blood test, and specifically they're looking for an antibody called GQ1B. They're going to be looking for that specific antibody in your blood, and that could also show that you're having these immune responses that are causing you to have a sensation of weakness or paralysis in your arms or legs. They're going to possibly do a spinal tap, which is going to take a small amount of fluid out of your lower back, and they're going to look for high amounts of proteins in the body's fluid. And it could also rule out the potential for a mimicker of Guillain-Barré, which could be infection. What they did for me was a nerve biopsy, which is what I just said too, where they took a small amount of muscle tissue and analyzed it for cell damage. That's what worked for me. And then the last thing is a nerve conduction study, where they're going to actually tape electrodes to the skin, and they're going to send a small amount of electricity through the body to look for a measurement of the speed of the nerve signals. And they can tell, by this, that there's something wrong with the body. So those are how you're going to get tested. Now it's time for treatment. Now for treatment, depends on the severity of where you're at with your diagnosis with Guillain-Barré. And that's going to depend on if you are going to get special blood treatments, or if you're going to get just physical therapy, or maybe a mixture of both. Me personally, I had to get special blood treatments. These treatments are called immunoglobulin treatments, or known as IVIG. They're intravenous, so they're put through your vein and they're ran as an infusion. And basically what this is it is a plasma component of blood that contains immunoglobulins of antibodies. These antibodies have an important role in the immune system. They neutralize bacteria, viruses, and they help with the destruction of bacteria and certain viruses or other pathogens. So they're very beneficial to your immune system. There was 2 different kinds of IVIG that I know of personally out there that can help, but there's also other brands out there too. Prevagen and Hizentra, those both are one of the ones that some of the doctors use. For me, I had to be checked into the hospital for these because insurance is a pain to deal with. They just do not want to approve it, but you need it if you have Guillain-Barré syndrome after COVID. And so they put me in the hospital, and I got these treatments. And within literally 2 days of getting these treatments, I was able to feel my legs again. I was able to feel my arms again. My finger sensation of being able to touch, it all came back, which is amazing. So that just shows you how important plasma donors are, first off, by the way. So thank you to our plasma donors, because without y'all, I wouldn't be able to walk right now. And secondly, time is of the essence with this. If you can get your doctor to diagnose you quickly with what you have, which is Guillain-Barré syndrome, or you could have the chronic version, which is called CIDP. And that is also a portion that's kind of like similar to Guillain-Barré syndrome. But basically what you need to do is time is of the essence. The quicker you can kind of go around getting a diagnosis for this, the quicker the treatment happens, the less damage that's going to happen to your body. Once you get those treatments, the next thing you have to do is physical therapy. You have to retrain those muscles. You have to retrain the nerves and kind of figure out what's going on. You have to change your diet. You know, you have to really look at basically a new life after you have this. And the diet for me that I followed is called the AIP diet, which is the autoimmune protocol diet, which limits inflammation of the body. And it's a very hard diet to follow, but I can't be off of it. If I eat anything off of that diet, I literally have a flare up and I can't feel my legs, or I lose sensation or weakness in my arms. And you know, it's serious. So what I want to do with this channel is I want to share my story with everybody out here. My diagnosis of Guillain-Barré syndrome. I also was diagnosed with POTS, which is posterior orthostatic tachycardia. And if you can tell from my mouth, Bell's palsy. My mouth is now crooked from COVID as well, and I had Bell's palsy when I was in the hospital. I got diagnosed with that as well. So I want all of us to kind of pull together and create a collaboration attempt of anyone else out there that's going through these issues, because it's not being told on the news. No one's talking about the neurological impact that has happened to normal people like us. And we need to work as a team to kind of figure out, all right, what can we do to inform other people of there are treatment options to get out there to help the severity of the issue and to possibly get your life back. Me personally, I'm suffering now from the CIDP, which is a chronic version of Guillain-Barré syndrome. And I'm having to get treatments often of the IVIG treatments, and I'm having to do physical therapy. I'm on disability right now while recovering. And if you're so depressed about this, I want to create a community for you guys, because I really didn't want to live anymore. I was so just over it. I didn't know what else to do. I mean, you can't walk, you can't get out of bed, your heart's going insane, you can't sleep because your heart's hurting so bad. You know, it's depressing, it's terrifying. And so I wanted to kind of create this video just to hopefully help somebody out there and see if you can find your neurologist, say, hey, I think I might have Guillain-Barré syndrome, or I might have CIDP, which is the chronic version of it, which is a little more mild than Guillain-Barré. And it's all because of an autoimmune response to the body after the virus. So please share this video with people, get the message out. Let's collaborate. Let's create a team, you know, of figuring out what we can do to help each other. And that's why I want to kind of pull our efforts together to do this and create this channel. And I'll be creating a couple more videos on my POTS diagnosis, how I got the diagnosis, what tests they ran to get that diagnosis, the treatment options for that as well, along with Bell's palsy. And I'll share another video of the diet that I'm following, because the diet is key. It's everything you eat after you have this. If you eat anything off that diet, you are not going to be able to recover. your immune system's just not going to be able to take a break, and you need to give your body the nutrition it needs that will not trigger an inflammation response to the body to be able to do that. So leave in the comments below what else you want me to kind of talk about, or if you have any questions, hit me up, because I want to help anybody out there. And be on the lookout for my next video, and I just be praying for everybody out there, and hopefully that this will help somebody.